Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Delighted today to bring on Dr. Hanypsiak with Physicians Regional Hospital. How are you this morning?
Hi, Amanda. Please call me Bryan.
All right. Maybe I'll get it right when I just use Bryan, right? Well, I just wanted to introduce you as an individual to our readers and our listeners and talk to you a little bit about what you do. So tell me who you are and what you specialize in.
Sure. So I'm a sports medicine orthopedic surgeon that specializes in surgery of the shoulder, knee, and hip. I was very fortunate in that early in my career, I invented a device for use in arthroscopic shoulder surgery. And I was able to come down to Arthrex and visit Naples, met with the owner of the company. And after they decided to utilize the device for their shoulder, they offered me a job to come and live in Naples and work at Arthrex and serve as the director of their educational programs for the United States. That afforded me the opportunity to meet all the best surgeons in the US, have them visit me in Naples and teach me all of their best tricks and tips and new surgical techniques so that we could incorporate those into our educational program. So I benefited from essentially a 5-year fellowship from some of the best surgeons in the country. So I basically will do everything in the knee, shoulder, and hip, including joint replacement, arthroscopy, and treatment of fractures.
That's really cool. I love hearing a little bit of history and background. So how long have you been doing this, and what are some of the new technologies that you're using in your surgeries?
Well, don't tell anyone, but my 20-year anniversary in practice is coming up really quick. So it's been going on for a while. And one of the things you don't realize is that the procedures and the techniques change so much that you're constantly learning and you're constantly progressing. So I thought back about it, and I really don't do any surgeries the exact same way I did when I started training. When we did joint replacements in my training, we did it all by eye, and we, put them in what we thought looked good. And sometimes we got it right, sometimes we didn't. Now we use a robot to put in all of our joint replacements, which allows me to implant them in the ideal place for patients within roughly 1/10 of a millimeter of the goal. And we're able to implant them successfully with less postoperative pain. We do arthroscopic rotator cuff repair. When I trained, it was open through large incisions. We drilled holes in the bone using these giant Carter row clamps and passed the sutures through by hand. Now we do it through tiny little poke holes smaller than my fingernail, and we're able to get an even better repair. So the technology has been fascinating, and it's been a constant learning process.
Now, I bet doing it with the robot and having such small incisions and holes is probably making the recovery time much more tolerable for folks.
Absolutely. And one of the things that we're really able to do is to cut down on the postoperative pain. We don't have large incisions to heal. And then one of the keys in joint replacement, one of the main advantages to utilizing the robot is we're able to measure things real time during the operation. So I'm able to know how much longer I'm making your leg, how much distance from your center of rotation I'm placing your new hip, how much stress I'm putting on your medial collateral ligament. So we can take these things into account when we make our intraoperative decision, and the patients will typically wake up with less pain and a faster recovery.
Gosh, technology is a beautiful thing. That's for sure. That's for sure. Now, I understand that you are the on-site physician for the Everblades. Do you want to talk to us a little bit about some of the injuries that you see on and off the ice and some of the challenges that you're going to be facing this year?
Sure. This is my 4th year as the head team physician for the Everblades. And number one on ice injury we see is probably concussions. The boards are plexiglass and they're very hard. And so the players are skating at fast speeds and we have high impacts. So we typically deal with a lot of concussions. For shoulders, the number one thing we see are separators where the collarbone and the acromion are separated. The ligaments that hold those together are torn, and you see the collarbone kind of inch up a little bit. I see that a lot off the ice too in older adults who fall and land directly on the point of their shoulder, and they will separate their collarbone. They'll come in with their collarbone up by their ear, and we'll talk about what we need to do to fix it for them. As far as lower extremity injuries, we typically see knee injuries in hockey from knee-on-knee hits, or if a player catches their skate in a rut on the ice and has a twisting injury to the knee. Probably the number one thing we see is a sprain of the medial collateral ligament, but we've had a number of meniscal tears on the team as well.
Okay. So I know that when an older person falls, it probably looks a lot like a hockey injury. What are some of the injuries that you're seeing in our geriatric population and some of the new technologies with those, dealing with people that are frail?
Well, Amanda, you would be surprised. It looks more like a car accident than a hockey collision. One of the things that surprised me, I practiced in New York before I came down to sunny Florida, and thinking with all the vitamin D and great sunshine down here, everyone would have strong bones. But as you know, the population in Naples tends to be a little older, and many of my patients have osteoporosis, which is thinning of the bones. And so when they fall, two things happen. Number one, reflexes are a little slower, so you can't get your hand out as quickly to stop your fall. So you tend to land a little harder on the side. And two, the bones are a little more fragile. So I take a lot of trauma call. And when patients come in, sometimes even small falls from standing height, just like a trip over uneven pavement, can result in fractures that are typically only seen in motor vehicle accidents.
Yeah, falls in Southwest Florida are one of the leading causes of death in the hospitals. It's such a serious thing. People kind of make a joke about it and say I'm falling because I'm getting older, but we at Seniors Blue Book and with our other partners, including a lot of physical therapy through Physicians Regional, want to just really caution our seniors to take that step. How often would you say you're seeing falls in your, injuries from falls in your office?
I'll see 3 to 4 a night on call, and even more in the office. Falls are, believe it or not, a very large shock to the body. The numbers are staggering in that for a male patient who breaks his hip, the mortality rate within 1 year approaches 50%.
Yeah.
So it's not necessarily the fall, but it's the body's reaction to the fall, the immobility or the inability to get out of bed and to ambulate.
Sure.
Really has people at higher risk for things like blood clots, swelling in their legs, and problems with their heart and lungs.
Yeah, and even socialization, once you take that fall and your body starts experiencing some of that, you're not able to go out and do the things that you used to do. So you lose motivation a lot of times. I've seen it with a number of geriatric residents that working in senior living where they take that fall and they're just never the same. So
fall prevention is a big key. Avoiding poorly lit areas, not utilizing your cell phone when you're walking, avoiding excessive use of alcohol, removing hard surfaces. Some of the worst fractures I see are on wet floors or tile in seniors' homes, and avoiding these things. Even simple things like if you know you're at risk for falling, using a walker or a cane, or even something silly like going to Dick's and buying a pair of baseball sliding pants.
there you go.
Shown to cut the risk of hip fracture dramatically.
Great advice. Well, thank you so much for coming on the show today and for being a value partner of Seniors Blue Book. We appreciate your time, and I'll let you get back to saving some knees and hips.